When they were shopping here, some of our elders, some of the store clerks would say, "Go home, you dirty Navajo. Don't bring your disease here."
If people really understood the history of Gallup and the history of McKinley County, they wouldn't be surprised of how much we were affected when COVID hit. They wouldn't be surprised. Access to healthcare has always been an issue for us. And there's limited resources for a lot of us. For McKinley County, there's about 75% Indigenous people here. I mean, you name it, McKinley County is probably the highest in our state, one of the highest, with teen pregnancy, suicide, domestic violence, substance abuse, even violent crimes, robberies. So before COVID, we've been suffering. It's hard for us to stay home. It's hard for us to have social distancing because that's not how we're set up to be. We're very social. We're very wanting to be with each other. We have to travel far. We can only buy food for so many days.
The fact that they live on the reservation where in a lot of cases there's no electricity, there's no running water, therefore it's hard for them to keep things sanitized and cleaned the way it needs to be. And there's no stores. There's 13 stores on the entire Navajo reservation. And 3/4 of them are convenience stores. But you don't see Home Depots, you don't see Walmarts, you don't see Safeways and Albertsons. You know, so the employment opportunity just isn't on the reservation.
This region did have one of, if not the highest per capita COVID infection rates as well as death rates in the country. Because of the remoteness, it can be hard for people to access care. So, I mean, everybody is always, if they can make it to GIMC, is certainly able to receive care at what I think is really quite a high standard. But sometimes it's just hard to access it. So that meant that sometimes the presentations were quite late, where people had been at home, not feeling well for long periods of time before they finally were able to muster the energy or the resources to come into Gallup. And by that point, that sometimes was too late.
We have a huge family, so it was a lot of interacting with one another and a lot of socializing, doing things together, like camping trips, farming, and just hanging out as a family, just doing everything together. And once this COVID hit, it was a scary situation. The hard part was my mother being admitted first, but then my brother started to get worse, started to get the symptoms, and he's younger than I am, so he caught it and he had it for like a month. And then all of a sudden, one day, you get the phone call that they're not here no more, and it hurt. So I lost my brother about 2 months ago.
It blew up on the Navajo Nation. As a matter of fact, it was the highest rate of infection per capita in the whole United States at one time, the Navajo Nation. People getting sick from COVID-19. And so people were being told, stay home, don't go nowhere. That's the safest place you can be. So if we're saying that, then the basic needs of our people getting out there and doing grocery shopping and these things, we stepped in there to say, hey, we can help you with some of this stuff in order so that you can stay safe. We would go to homes and help them with the basic necessities, food, water, and then later on, things like hygiene kits, quarantine kits, isolation kits.
We have a positive active case, we definitely don't want them out and about. You know, if we can just have them stay at home, we can bring food to them, bring some cleaning stuff for them, and hopefully they recover. Sometimes they don't recover, they got to get flown out. That happens. We've lost a few people. Some have been out there for hospitalized for a few months.
At first it was kind of like scary because I have a 4-year-old son, and I live with my two grandparents who are pretty much like 80, 90 years old. So it was pretty scary at first to where I was really using the sanitizer and spraying my clothes down when I get home and taking a shower right when I get home and putting my clothes in bags, my shoes in bags, because I was pretty scared to not just to catch it, but to give it to my grandparents or to my son. There were a couple of times where I had to sleep outside in a tent just because I was trying to be cautious.
Upstream is where we really need to focus on to provide better food access and better educational access. The whole systemic racism system needs to be deconstructed.
We continue to fight for our lives every day, even before COVID, during COVID, even after COVID.
I just wish that everyone would just come to an agreement, or everyone would understand how serious it is. It's no joke, this pandemic.
Hey, thanks for watching. If you like this video, check out these other videos from USA Today to stay up to date with all the latest news.